Good morning. Today we are going to discuss about tracheoesophageal fistula, or it's also known as esophageal atresia. It's one of the congenital anomalies which is present in a newborn and among some of the children also. So the term itself is telling tracheoesophageal fistula. Fistula, generally we can say it's an abnormal connection between any two organs. Here the abnormal connection is present between trachea and esophagus. Trachea is a part of respiratory system, while the esophagus, that is a part of digestive system. So the both systems are different, but due to some anomalies or due to some of the problems, there is an abnormal connection is present between trachea and esophagus. And another thing, esophageal atresia. Atresia is a condition which is considered as an absence of any organ. So atresia, esophageal atresia, in the sense there is an absence of esophagus. Opening of the esophagus is absent. So in the sense, esophagus is closed somewhere. So this is the general definition. Once again I repeat the definition. It's an abnormal connection between trachea and esophagus. A trachea is a part of respiratory system, while the esophagus is a part of digestive system. Now we'll move to the basic anatomy of the digestive system. Whenever we are taking any food, firstly it goes to the mouth. Through the mouth it goes to the esophagus. Esophagus having two sphincters. One is upper esophageal sphincters and another is a lower esophageal sphincters. With these both the sphincters are help into the movement of the food to the next part. So through the esophagus the food will goes to the stomach. Stomach having again three parts. One is a body, fundus and pylorus. Again these having sphincters. Pyloric sphincters is there, which is going to be control or regulate the movement of the food to the next phase. The stomach is later on connected with the small intestine. Small intestine having a three part: duodenum, jejunum and ileum. Duodenum is the first part of a small intestine, while the jejunum, duodenum and ileum. Ileum is the last part of the small intestine. Now the small intestine is connected with the large intestine. Large intestine having a two part. That is, we can consider it's a cecum and colon. Colon having again four parts, that is a ascending colon, transverse colon, descending colon and sigmoid colon. Later on it is connected with the rectum and anus. This is the normal anatomy of the digestive system. But in all this scenario there is an abnormal connection between esophagus. Esophagus should be connected with the stomach later on, but in that case esophagus is connected with the trachea. So whatever the food a child is taking, it will goes to the trachea and then it is going to be stuck to the respiratory system. That's why it is very difficult condition. There are some of the basic terminology which is very important. Trachea is considered as a windpipe. Congenital, any anomalies which is present from the birth. Proximal, that is the upper part of any organ. Distal end, that is a lower part of that particular organ or any pipe like structure. Fistula, as I have already discussed, it is an abnormal connection between any two organs. Now we are going to be talk about types of this tracheoesophageal fistula. There are basically 5 types of tracheoesophageal fistula which is mentioned in the various books, which is considered type A, type B, type C, type D and type E. Type A is a condition wherever the upper esophagus and lower esophagus both are converted into the blind pouches. Means upper esophagus is not connected with the lower esophagus and both are different with each other. That is considered as a type A. Type B, where upper esophagus is connected with the trachea while the lower esophagus is considered as a blind pouch. Type C, wherever the upper esophagus is connected with the upper esophagus is a blind pouch while the lower esophagus is connected with the trachea. Type 4, wherever upper esophagus and lower esophagus both are connected with the trachea but with the different passages. And type E, which is the last, this is where the both firstly they both are connected, upper and lower esophagus, to each other, and then they later on they are connected with the trachea. So it is also known as a H shape. The type 3, wherever the upper esophagus is a blind pouch and lower esophagus is connected with the trachea, it is the most common. 70 to 80% cases this type of tracheoesophageal fistula is present. Now we'll talk about what are the common signs and symptoms which is present into the tracheoesophageal fistula. So the commonly signs and symptoms we can see, first important symptom is excessive salivation. in the sense there is a presence of excessive salivation. When you are going to be give treatment to the child, there is an excessive saliva is present into the mouth, or there is a drooling of the saliva, means through the mucuses are there is a, it will be drooling from the mouth, so that is a drooling through the mucus. Then most important symptoms, sign of this condition are 3C, that is a coughing, choking and cyanosis. Once again 3C, coughing, choking and cyanosis. Then there is a increased respiratory distress, that is also one of the another sign. Then the most important another sign is that whenever you are going to be insert a catheter through the mouth or through the nose, it will be stuck somewhere, it will not reach to the stomach, because there is an abnormal connection, the catheter will go into the trachea. So that's why this is also one of the most important indication if there is a no insertion of the catheter. This is also one of the important. So basically the sign and symptom 3C's, that is a coughing, choking and cyanosis, and then drooling of the saliva through the mucus, and there is a blockage of the esophagus. These are the one of the important symptoms which is present here. Now we can say what are the causes for this particular diseases. The causes of this disease is mentioned if the baby is LPW baby, if there is a growth retardation into the baby, if mother was unhygienic during the delivery time, if there is an abnormal presentation of a baby, if there is a condition of polyhydramnios is present, if there is a birth asphyxia is present into the baby. So these all are the common symptoms, common causes through which this disease can be developed. Now we are moving to the management of this particular case. So generally into the management, basic, because it's an abnormality congenitally, so for that we require a small surgery. So the surgery is considered as anastomosis, where upper esophagus and lower esophagus both are right now not connected. So through the anastomosis we are going to be connect both the end of the esophagus, upper esophagus and lower esophagus, and then we are going to be doing tracheostomy, so that the trachea will become open and there will be an open passage for that. So this small surgery can be conducted when the child is suffering with this particular condition. Once the surgery has become conducted, then later on there will be some post-operative care, keeping airway clear by the suction, proper administration of oxygen is required, monitoring of the thoracic drainage, there is also one of the important consideration, care of the operative site to the prevent infection. Just to prevent infection we have to be take care of the sites wherever the surgery has been conducted. Then for 1 or 2 days we will not give anything through the mouth to the child, and then slowly we will check it out the improvement status of the child. So this is all about the tracheoesophageal fistula. I believe this was the one of the most important disease condition as per the exam point of view. So please listen carefully, especially the types, type C which is the most common, and H shape, that is considered as a type E. Fistula, it's an abnormal connection, and anastomosis, it's a surgery, tracheostomy and anastomosis, this is the two surgery which is very important in this condition. I believe you understand about this whole topic. If you are facing any issue, please call me. Thank you. Now I am sharing a quiz for this particular lectures to you, please attend it. Thank you.